Hi, this is Dr. Fox, and let's talk about the cutaneous innervation of the face. In this video, we'll discuss the dermatomes of the head and face, the particular divisions of the trigeminal nerves that serve these dermatomes, and the major terminal cutaneous nerves of the face. So, first of all, what is a dermatome? A dermatome is a region of skin which is solely supplied by a single nerve. In the case of the head, there are gloriously few dermatomes and nerves that serve them. So let's take a look at some of the regions and the major nervous supply to those regions. So a major player in the face is the trigeminal nerve, or cranial nerve number 5. The trigeminal nerve has 3 major divisions, as you can guess by its name, and we call them V1, V2, and V3. V because of the Roman numeral 5 there, so delightfully awkward. So V1 is the ophthalmic division. V1 predominantly is going to serve the orbit and the contents of the orbit, but there are sensory components to it. V1 is going to exit the cranial cavity through the superior orbital fissure on its way to serve the orbit, and eventually its terminal branches, things like the infraorbital nerve and the supratrochlear nerve, are going to exit the orbit to serve this area. So if we draw kind of a line over the ala of the nose up to the medial palpebral canthus, across the fissure, and then in an arcing line up over the distribution of the epicranial aponeurosis back to about here, we have the region served by terminal branches of V1. V2, the maxillary division or maxillary nerve, is going to exit the cranial cavity through the foramen rotundum, and it's going to serve predominantly the deep face, some of the sinuses, and its terminal branch is going to be the infraorbital nerve, and it's going to serve this dermatome here. So if we go sort of the upper lip from the angle of the mouth back to the masseter, and then we go all the way up to where we intersect with that division between V1 and V2 there. That's that region that's served. And then V3, the mandibular division or mandibular nerve, is going to exit the cranial cavity through foramen ovale, and it's going to supply a lot of the deep face from the infratemporal fossa, so this region in here. And then there will be terminal nerves, auriculotemporal, heading up that way, the mental nerve, which is the terminal nerve of the inferior alveolar nerve, heading out that way. So we've got another distribution there. So all basically of the mandible going back, except for the corner, by the angle of the mandible, back to the tragus of the ear, up and around. So all of this is going to be V3. Now there is a mnemonic for knowing where these divisions exit the skull, and that is standing room only. So as many times as we can hear that will be helpful. And then the remaining 2 dermatomes will be branches from the cervical plexus and dorsal rami of cervical nerves. So dorsal primary rami of cervical nerves. But the face, the dermatomes that we are concerned with here. So let's take a look at each of these nerves as we go. So we'll start with the V1 branches. So there is a branch of V1 called the frontal nerve, which we'll see in the orbit. And it divides into the supratrochlear nerve, which takes more of a medial course in the orbit, and the supraorbital nerve, which takes more of a lateral course. The supraorbital nerve exits through a supraorbital foramen, or sometimes just a notch. So here we can see the frontal nerve going out, medially supratrochlear, laterally supraorbital. And the supraorbital nerve is going to serve the superior palpebra as well as the forehead on the lateral side, whereas the supratrochlear, more the medial palpebra and the medial forehead on that side. We can get a little preview of the infraorbital nerve of V2 there. Moving down. So there's the supraorbital foramen, but that could be a notch. There's the infraorbital foramen with the infraorbital nerve moving through it. So that fascial space, if you recall, is similarly named. That's the infraorbital fascial space, also known as the canine space. And moving right along to V3 branches. So this is the infraorbital foramen, infraorbital fossa, and we can see all of this, which is V3, and we have the auriculotemporal nerve, which serves the temporal region and just anterior to the ear. We have the mental nerve, which is the terminal nerve of, or branch of the inferior alveolar nerve, which we'll discuss in detail at a later date, that exits the mental foramen to distribute about the mental region or the chin. And we've got the buccal nerve, or the long buccal nerve, which you will have recalled as moving through that buccal space to serve the skin of the lateral cheek. A lot of clinicians refer to this as the long buccal nerve, but it's just the buccal nerve of V3. Which brings us to our assessment question of the video, and that is, shingles is a reactivated infection of herpes zoster. It can manifest as a painful blister along the dermatomes served by infected nerves. A shingles infection that is affecting the superior eyelid is indicative of which nerve being involved. Is it the buccal or long buccal? No, that's over the cheek. Infraorbital, well, it does say orbit, and we are talking about superior palpebra, but if you recall, infraorbital is going to be V2, so that is not correct. Mandibular nerve, this is an error here. Mandibular nerve is V3, so that is incorrect. Maxillary nerve, I see what we did here. That's V2. That's also incorrect. Or ophthalmic nerve, V1. Yes, V1, or the ophthalmic division, is everything superior to the palpebral fissure. So that is the correct answer. So thank you so much for your time, and I look forward to talking to you in the next video.